let's get going. What I want to do is run through some of the basics of outcome harvesting for the work that you do. But before we do that, I just want to walk through the agenda for the session and give you a quick overview of sort of what we're doing and why we're doing it. And the first thing to say is that this is not a one-off workshop. It sits in a broader context, and that context, I think, starts with the Interaction GBV Prevention Evaluation Framework, which I presume you've all seen, was published earlier this year. And in that framework, we're looking at a range of aspects to do with GBV risk analysis, setting up monitoring systems, doing theories of change, but also monitoring and evaluation methods. And so what we're doing with these workshops is providing an opportunity to go into more detail on one or two or three of the individual evaluation methods that are in that framework. So it's in that context that we're holding this workshop. And today, what we're doing is zeroing in on outcome harvesting. So that's just one of the tools that are in the framework for looking at evaluating GBV prevention activities. It's actually a tool that you could spend a week looking at. So we've just got to sort of highlight some of the key aspects of that work and provide pointers for further follow-up afterwards. So what I want to do is to introduce the basic methodology and discuss how it can be applied to GBV prevention work, as well as looking at some of the strengths and weaknesses of that methodology, both as an evaluation tool in its own right, but also in application to GBV work. And then lastly, I think we should try and practice as a group the forming of outcome statements. So don't worry, we'll come on to what outcome statements are shortly, but it's a critical part, and perhaps the hardest part of doing outcome harvesting well is forming good outcome statements. So what I want us to do is just discuss how we'd go about doing that, and then understanding how to judge if we have a good statement or a bad statement, and to get some progress there. I think if we could do that, then in addition to the background resources that we shared with you before this session, I think you're in a really good place to start thinking about applying this in your work if you're interested. So before we continue, I just want to give you a very, very brief introduction to the framework itself, right? So here we're looking at the GBV Prevention Evaluation Framework that was published by Interaction earlier on. This is essentially a set of guiding principles and approaches. These are approaches that practitioners can use to try and improve the kind of program design and the GBV analysis, and then the measurement tools that are used for specifically preventive work for gender-based violence. If you wanted to know the question that the framework's asking and trying to answer, it's how can we improve the evaluability of prevention work in this area? And that's on the basis of the scoping work that Interaction had previously done, where they identified some weak sort of areas of weakness in the GBV prevention activities in the field, including on the context specificity of risk analysis, on the context specificity of project theories of change, and on the shift, sort of the focus sometimes on output level monitoring rather than outcomes. Some other problems too, but these were kind of core problems that the framework is trying to address. And we hope that framework, and Interaction hopes that framework can be used by field-based practitioners, headquarters staff in protection teams, GBV advisors, and then really for any organization that has GBV prevention as a declared outcome. To be clear, there's different modules in that framework. So when you click on the Interaction website and you go find that framework, you'll be able to see a section on how to do risk analysis, how to do project design, how to set up a monitoring system, and how to choose between different types of outcome-oriented evaluation approaches. So there's a lot there. We're not going to go through all of that today, but that's the context that we're in. And today we're going to focus on one of those outcome-oriented evaluation approaches, namely outcome harvesting. Just to sort of give you an overview of what we're going to cover and when. No, we're a little bit behind, but we'll catch up that time. So what we want to do is a presentation of what outcome harvesting is, just the bare bones of the idea, and then a discussion of how we think it could be potentially used in our work. And then I'll give a presentation of the method, really the how-to, in a very brief version, followed by an exercise. So we'll put you all into separate breakout groups, and I'll ask you to try drafting an outcome statement to get a good sense of how you'd go about that work. And then we'll look at some of the organizational requirements, so what you need to have in place for your organization in order to use outcome harvesting well. And finally, another exercise where we look at the quality of outcome statements. So we sort of begin to learn about how to judge and quality assess some of the work that evaluators do in this area. And then lastly, we'll just wrap up and give a few pointers to future workshops and future work. So with that, I'm going to hand over to Ife at Interaction for a brief icebreaker so that you can all get to know each other. There's a lot of you in the room, and I want you all to get a chance to just kind of see each other's faces on the screen, and then maybe have a little one-to-one icebreaker as well. And forgive me, I haven't introduced myself, so I'm going to take the opportunity to do that. My name's Neil Dillon. I don't work for Interaction. I'm an independent consultant. I work with Data Conscious, whose logo you can see, and we helped Interaction to draft the framework itself. So I'll be running the session. My experience is in monitoring and evaluation for humanitarian protection work in particular. But I'm also joined by many Interaction team members who you can see on the screen. And I'm going to pass you to Ife now, who's facilitating the icebreaker, who will begin. Over to you, Ife.
Thanks, Neil. Hi, everyone. Hope you all are doing well. As Neil mentioned, my name is Ife. I'm a program associate with the protection team at Interaction. Before we get started today, we have two quick icebreakers for you today. The first one we'll do in plenary, and the second in separate breakout groups. For the first one, I need you all to select Gallery View on your Zoom browser. You should see a button at the top right of the screen that says View. And once you click on it, you should have the option of selecting Gallery View once you click on View on the top right hand of your Zoom screen as well. So please go ahead and click that now. And then once you've done that, please react by giving me a quick thumbs up via the reaction feature on Zoom to let me know you found it.
It might help if Neil stopped sharing his screen so we could see everyone. Thanks, Neil.
Has that worked, or we're still sharing?
You're still sharing your screen. Perfect. Thanks, Neil. But is everyone being able to change their view to gallery view? If so, you can give me a quick thumbs up, either the reaction button, or if you have any questions, please do let us know. We can try and help you as soon as possible. Okay, I see people giving thumbs up. Thank you all for confirming. So before we start with everyone on gallery view, you can see how many participants we have here today. And as part of the first icebreaker, I'm going to ask you all 3 questions. I want you to either turn on your screen or give me a thumbs up if your answer is yes to each one of the first questions. So everyone, please go ahead and turn off your camera screens if you'd like to turn on your camera as your response as well. Thank you. And the first question is, please turn on your camera screen if you're joining us from a country or field office today. So only those from field offices in your main countries of operation right now. No one from headquarters yet. So please turn on your camera or screen if you're joining us from a country or field office today. Okay, we have a couple of people from field office. That's great to see. Absolutely. No one else? Okay. So please, everyone, turn off your screens again. Ready for the next question. Please turn on your screen if you're a gender-based violence or protection specialist. So only those with GBV or protection work as a primary area of focus in their day-to-day jobs, please. Okay. That's a decent amount as well. Thank you all for participating. And then for the last question, please everyone go ahead and turn off your screens again. Please turn on your screen if you spend most of your time doing monitoring and evaluation. So that will definitely be the M&E folks, but these days it could be all of us. So only if you spend most of your time doing monitoring and evaluation. I see many of us have turned on our screens. Thank you. So now that we've done a group introduction, we would like to invite you to learn a little more about each other. So we'll be sending you off into one-to-one breakout groups in a moment. You only have 60 seconds to say hello to your partner. It's pretty quick, but it's a minute, and it should be enough time to sort of get to know your partner pretty quickly. So you need to be fast. I want you to start by asking each other the following question. What is your favorite dish for cooking and eating at home? The question is, what is your favorite dish for cooking and eating at home? So when the breakout invite comes onto your screen, please join your partner for the one-to-one icebreaker. Give me a second while I load this up. Perfect. You should be able to join the screen immediately. Please go ahead and join your one-to-one breakout group. Welcome back, welcome back. Apologies, the breakout room lasted slightly longer than anticipated, but welcome back. And I hope the amount of time you guys had was able to sort of learn about your partner's favorite dish to cook while at home. Thank you all. Those are the two icebreakers we planned out today, and Neil will be passing them back to you.
Great, thank you, Ife. I hope you all had a chance to get to know each other a little bit. And now, Ife, if you keep your screen on to give me a thumbs up about whether I have figured out how to work this properly. Tell me, what can you see? A full slide?
Yes, we can. Great job, Neil.
Excellent. All right, we're getting there. Thank you. Okay, so what I want to do is just run through what outcome harvesting is. It's a very basic presentation. I'm not going to give you the nuts and bolts of how to run it. I just want to discuss what it is and how it can potentially be useful for the work that we do. Overarching picture, if you're a million miles away, what would you say? Essentially, outcome harvesting is a tool for capturing change. That's really it. So the point is that you're using it to collect examples, really good detailed examples of things that have changed in the community or in the lived experience of the people that we serve. Once you capture those changes, you then work backwards to understanding what the project has done to contribute to those changes. That's really the critical point and the critical insight that came from outcome harvesting. You work, first of all, with understanding what's changed in the community, and then you work backwards to understand how your project relates to those observed changes. it grew out of the work of the late Ricardo Wilson Grau, who worked for about 20 years on and off with Oxfam Novib, developing, piloting, and furthering the methodology for doing outcome harvesting. It's hard to say exactly which domain this came from, but a lot of the early evaluations that were used to develop this methodology were in areas like governance reform, justice reform, peace building. These are all areas where you have quite complex relationships between the activities that you do and the changes that you're trying to bring about, because there's such widespread, wide scope changes. So that's a key point, that actually that was the methodological challenge that Ricardo was trying to deal with. It also is fair to say that it focuses a lot on the perceptions of communities about what has changed. So it doesn't matter what your log frame says, and it doesn't matter what your theory of change is. What we're really looking at with outcome harvesting is what the community thinks has changed over the last 3 months or 6 months, or whenever it is you're asking, in whichever location it is, about whichever topic it is that you're asking them about. So it's not really focused on your log frame, it's focused on the community perception of change. And the last point is that it's especially useful in a context where you have a project and you can't really predict at the outset what the outcomes will be. The reason for that is that you don't need a theory of change or a developed theory of change to make this work. So instead of trying to say, I know what my project's going to achieve, and then going out and rolling it out in a mechanistic way, if you have a project like something on peace building or justice reform, where you think it might lead to the changes you want, but you're not sure, and you don't know what the unintended consequences will be, and outcome harvesting is a great way to evaluate it, because you're not looking at the theory of change of the log frame, you're looking at what people in the community that we serve think has changed. So in a nutshell, that's really what it is and where it comes from. We should clarify a couple of points on terminology, because it can get a bit confusing, I think, and it doesn't need to be. So the first point is that for people that do outcome harvesting, for evaluators that specialize in this, when they say outcome, they mean a change in the behavior, relationships, actions, policies, practices, commitments of social actors. So that could be individual people, groups, households, communities, organizations, or even sort of institutions in the metaphorical sense, like the justice sector or something like that. So what they're talking about is actual changes in the world, observable changes that are being done by individuals in the communities that we serve. An outcome harvest is just the action of identifying those changes and then interpreting them to use them as answers to an evaluation question. And it has to be based on this kind of 5 or 6 step methodology, and that it's quite important that we keep the steps separate to make it a proper outcome harvest. An outcome statement is what you collect. When you're doing an outcome harvest, you collect these short, crisp 1 or 2 sentence statements of who has changed, what they've changed, when and where they changed it, and how it was influenced by the program. We're going to come on to this as we go through the session, but these are really the core essence of outcome harvesting, is developing really good outcome statements and verifying and consolidating them and then using them for analysis. Okay, so that's the basic outcome harvester terminology, the glossary for them. But the point is that for GBV prevention, there are slightly different terms. And so we need to be clear about what we're doing. So if you look at the interaction evaluation framework for GBV prevention, an outcome is the reduction in GBV risk faced by communities and individuals as they live through crisis. And the result of prevention work is changes in attitudes, behaviors, policies that underlie that risk, right? So there's a slight difference here. Results in the GBV prevention terminology are similar to what outcome harvesters called outcomes. So we need to kind of have a double speak in our head, in our minds when we think about this. But what I would say is we don't need to worry, because the only point to hold on to is that when we talk about outcomes, we need to be talking about changes in the lived experiences of community members. We're not talking about outputs or deliverables or activities or money spent. We're not talking about the program. We're talking about the world of the community, the people that are living through crisis. And if we keep talking about that, then we're basically talking about outcomes and everything should work. But it's just worth noting that there is a slight terminological difference between outcomes and results when you compare the evaluation community or that part of the evaluation community to the work that we're doing on GBV prevention. So terminology aside, we should look at some of the strengths and weaknesses. So really, when you think about outcome harvesting as a whole, rather than just its application to GBV, there are some strengths and weaknesses to this methodology. It's not the one methodology that we should use in all cases. There are particular strengths and particular weaknesses. So if you look at the strengths, it's extremely good at looking at complex projects. So if you don't know what the results are going to be, or if it's hard to understand the causal link between your work and the results, this is a good time to use outcome harvesting, precisely because it can be used even when you don't have a strong theory of change, and precisely because it's really good at uncovering unintended consequences. So even in a situation where you don't really know what's going to happen with your project, outcome harvesting is very useful. And so for that reason, it's very good in complex situations where, for example, external actors or perpetrators or duty bearers might have a massive influence on the results of your program. This is actually quite a good methodology because it can help you unpick what actually happened and how it relates to your project. The last point is that it's very good at sort of verifying the results of your work with the people that you serve. So it's very good at engaging external project stakeholders to really consolidate, or rather to verify the truth of the statements that you're building. So that's on the good side. On the weaker side, it can only capture easily observable change. So if you have a change that's related to, I don't know, something as a macroeconomic policy or something to do with the internal monologue of someone that you're working with, these are hard things to change, to observe. What things are easy to observe are changes in behavior, things that people can report and write down in a report. So it can only really capture those easily observable things. So if you're looking for hard to observe changes, then it's not such a strong tool. It's also not so great for measuring how far you have achieved your planned objectives. It won't give you your, I'm 30% of the way there, 60% of the way there. It doesn't really do that. It tells you what has happened, not how far you've got towards making something happen. And the other points are really that it can be hard work. So Ricardo Wilson Grau has written a lot. He has written this book, which I would encourage you all, I'll show you later, I would encourage you all to look at. I've quoted from it in the presentation. He's written other papers, other people have written stuff. The reason there's so much written about it is it's actually quite hard to do and to do well. So you do have to bear that in mind when you're planning for it and when you're recruiting an evaluator to do this kind of thing. It can also be data intensive. So if you have lots of outcomes, you can end up with hundreds of outcome statements that all need to be reviewed and verified, and that can take time. And in some cases, it can be a bit extractive because you could be going to community members to say, is this true? Did this happen? When did it happen? Who changed what? And it can be a bit of an extractive dialogue that can be managed and it can be mitigated, but it needs to be borne in mind. So when we think about applying that to GBV prevention, I would say the first point to bear in mind is that there's two real good strengths. One is that this method treats all outcomes equally. So it doesn't matter if you meant to achieve this or not. It doesn't matter if it's in your log frame. It doesn't matter if your monitoring reports picked it up or if your monitoring reports aren't good enough to pick it up. None of that matters. What matters is that it's observable. And once you have an observable change, this methodology treats them all as being equally important. It doesn't give a hierarchy of importance of any sort. So that can really help you understand the impact of, say, your intimate partner violence prevention program on something else, some other form of GBV or a wider social norms change like gender equality or something like that. It can really help you unpick the kind of unexpected changes that you weren't really planning and treat them as equally important as the other ones. So that's really important. The second benefit is that it helps you treat stakeholders equally. So you might have outcome reports, people saying the men in my community stopped doing this or started doing this, or the community leaders started to do this. And you might have different people in the community who diverge on whether that's true or whether that's a good thing or a bad thing. Well, outcome harvesting doesn't give a ranking. It doesn't give a hierarchy to it's important what your country director thinks compared to what somebody in a village thinks. Outcome harvesting doesn't care. So this is a good way to compare the different perspectives across what can be quite contentious changes in a community, and help you to unpick some of those dynamics. So in a situation like that, which you do get with stuff like GBV prevention, outcome harvesting has a strength. The last point is, I think, obvious, but very important, is that with GBV work, data management, data collection, and privacy are hugely important issues. Outcome harvesting does involve having conversations with people about quite difficult things. So you might be having conversations with community members about changes in behavior or attitudes on gender and violence and sexual violence, difficult things to talk about. And so data collection principles, do no harm principles apply in data collection, but also in data management in terms of seeing who gets access to this data. Again, I think there are ways to mitigate these risks, but they are really important to take into account when we think about applying this kind of method to GBV prevention. So let's pause there. I just want to check in with everybody, really. First of all, to give you a chance just to raise your hand or add a comment if you have any questions about what I've just said, or if you want to know about what we're about to do later. But also just to ask you to think and to maybe share your thoughts on how useful this could be or how useless this could be for GBV prevention. Just whilst you think, I mean, if you do have any questions, just put a thumbs up or raise your hand, or simply turn on your camera so that Jessica can field or pass the question to me to field. But just to get you thinking, I would say there are a couple of things that you might want to think about. One is that you'd be interested to know what you think are the most interesting aspects of outcome harvesting as I've described it so far for your work. So what stands out as being potentially useful for you? But then also, what areas do you think are going to be the major challenges to applying it to your work? And then lastly, when do you think you would do it? How frequently do you think you could do it? If there are M&E specialists here, how does it fit alongside your donor reporting requirements and your other monitoring systems? Do you foresee any problems in terms of integrating it with that other work? So over to you guys. If anybody has a question, like I say, please do raise your hand, or simply turn on your screen, and I'll try to answer your question as best I can.
Neil, we have Betty who's raising her hand, her physical hand.
Thank you, Betty. Over to you.
Thank you very much. Betty Adera is my name. I work for Global Communities as the Senior Technical Advisor for HIV/AIDS and Health. And I am an IO staff, but based in Nairobi, Kenya. So one of the programs that I am in charge for is an adolescent and young women program that deals with HIV prevention, the DREAMS program, if some of you might be knowing about it. And one of the key interventions surround prevention, mitigation, and response to all forms of gender-based violence, and this is in Botswana. By the time I joined this program, it was midway. The baseline assessment had been done. And when I looked at the GBV components, it's like there was nothing. The questions that were asked, achieved nothing. And you cannot tell me that in an African context, in a rural community, there is zero, incidence of gender-based violence. And this was even in contravention of the national data. Now, we are at a time when we are looking to doing an end of program evaluation, and I cannot thank you enough for this particular session that we're having and the tools here, by way of saying that it could help, harvest some very sensitive, private information around GBV. Question though is how can we use this tool on community members who are minors? Like we have girls who are just adolescents, they have not yet received, the age of being considered legally an adult, and they have experienced, GBV a good chunk of them are at very high risk, of GBV. So how can this tool, help me? Because I'm at the time when I really want to employ this methodology for outcome harvesting in an end of program evaluation on a program that deals with GBV prevention among adolescent girls and young women. Thank you.
Thank you, Betty. Such a clear question. And really good that we raised this now at the start, I think. Jessica, if I may, there was a comment in the chat which was about how this can fit together with monitoring systems, if I've understood it correctly. And if it's okay with you, Jessica, I think I might try and answer both of those questions at the same time. Are there any other ones that are coming in that I should pay attention to?
I haven't seen any others come in, so yeah, go ahead and take both.
So the reason why I'm going to lump those together is that, Betty, I think the answer to your question is a little bit in the relationship to the other monitoring system, or the other work that you do. So first of all, absolutely understand the risks that you're talking about, but the tension, of course, is that you need to capture this data, because if you don't find a way to hear the voices of these minors and their experiences, then you're going to miss out on understanding the results of the work that you're doing, which could potentially also be dangerous. So there is obviously this tension. What I would say is that outcome harvesting, in a way, there's no answer, because outcome harvesting isn't about the way that you speak to someone, right? So I think that the answer to your question lies in the way that you design survey or interview tools, and the way that you select households for engagement, and the way that you engage with parents or other actors, or perhaps peers of the minors, or perhaps school teachers. The selection of the way that you go about extracting information from people is the answer to your question. But the reason why the other question about monitoring systems is important is that if you're going to do an outcome harvest for the project you spoke about, the first thing you would do once you've set it up and you've designed the questions and all of that is review the monitoring reports, and review quarterly statements, and review other sources of information. So before you've even gone out and asked anybody anything, you need to make sure that you've really thoroughly reviewed all the available information. So outcome harvesting doesn't work if you don't do that. And the threat that you're talking about can partially be tackled by trying to look for as many available sources of information as you can find before you start speaking to community stakeholders. The second point is that the next step is to speak to people that are familiar with the project, and potentially people in the community who are closely related to the project. So here you could try and bring in community members who will be well positioned to understand some of the issues that you're talking about with the threat to minors. So you can start to bring in information there all the while before you even begun to approach the idea of going out to wider community members. And then the next step will be to verify the statements that you've got from a selection of people in the wider community. So the reason why I'm explaining this is that I think the answer to the question is in the way that you select who you speak to at each of those points, to try and capture information about the risks that minors are facing, but without obviously doing harm in opening up conversations in an inappropriate manner. So I think, I'm sorry, because the answer to your question I think is very context specific, and we need to think about how we go about selection criteria for interviews. But the general point is that outcome harvesting provides lots of entry points for you to consider that, to try and capture that information in a safer manner as possible. So I hope that goes some way to answering the question, Betty. If you think so, give me a thumbs up or a thumbs down, and I'll see if I can address it better. Great, thank you. Okay, Jessica, are there any other questions to look at before we move on with the next session?
And there is a comment in the chat from Jacqueline from WFP. I don't know, Jackie, if you want to speak on it yourself, or I can read it. But she indicates that she really appreciates the starting point with the community perception rather than our own program objectives, and really keeping an open mind for monitoring. But then somewhat of a question here, she also indicates that she thinks the drawback would be how we can attribute that change to humanitarian action, which I assume we would need to do to inform and improve programs.
Thank you. And don't worry, Jacqueline, I know what it's like to be on a webinar when you're in loud space. fully understood. Yeah, so I appreciate that, and I think you're bang on. You're exactly right. There is a question about attribution and contribution. We'll come on to that because I think that the tool of outcome harvesting, as developed by Ricardo Wilson Grau, attempts to start looking at that not through core attribution claims, but through some contribution analysis. But I also think that there are other tools that can be used in conjunction with outcome harvesting that can strengthen that claim. So that's essentially a plug for the next workshop. Like, we need to start thinking about ways that we understand the relationship between the changes that we've observed and the program activities in a robust way. But there are lots of tools out there for doing it, and a lot of them, most of them, are in the interaction GBV Prevention Evaluation Framework. So we'll definitely come on to those points. Okay, so we are at time. Jessica, is it okay if I move on, or do we have any other urgent questions popping up?
I don't see any others, so I think it's fine to move on.
Great, thank you guys. Thanks for the good questions. So what I want to do is run through the kind of a brief how to do outcome harvesting. To do that, I'm going to run through the 5 steps of the method as described in the interaction framework. It's a slightly shortened version of Ricardo Wilson Grau's 6 steps, but I've got all 6 steps, but they're just kind of put together in some ways. It's a bit hypocritical of me, because I think one of the important things about doing outcome harvesting well is maintaining the distinct steps as far as possible. So we'll come on to discussing that later. But really, I just want to walk through these steps with you so you can get a sense of how they work together, essentially. To do that, I'm going to use a project example, an entirely fictional project example. I hope you all had a chance to see the background documents that we shared before the session. In those documents, we had a fictional project example. We gave you some detail about intimate partner violence in Warrap State in South Sudan, and we gave you a kind of a risk analysis of the gender-based violence risk there, a log frame, and some monitoring reports and some interview quotes, all of which I emphasize is 100% fictional. None of it is true or taken from something that is true. This was made up. None of this is related to anything real. However, it's a useful way to look at how these 5 steps relate to each other. So I'm going to briefly introduce to you the fictional project now, and then I'm going to walk through in more detail how you'd go through those 5 different steps if you were to do an outcome harvest. So let's begin. We have on the screen now a brief version of the risk analysis for this particular case. So that's broken down as per the interaction framework, and as per the risk equation for doing gender-based violence prevention work, 3 categories: the threat, the vulnerability, and the capacity of community members to respond to the risk in question. So let's walk through those points briefly now. The threat, we have male heads of household using intimate partner violence in domestic disputes. We're seeing physical and sexual assault being used mainly inside the house, inside the home. It's more frequent when the head of household is unemployed and socially isolated. And the reports of intimate partner violence rise during conflict and food insecurity, which we're sadly seeing right now in Warrap State. Local leaders also support the use of intimate partner violence and ostracize and support the ostracization of survivors who report it. So that's the threat that people are facing in these communities. In terms of the vulnerabilities to those threats, we have women and daughters of unemployed and socially isolated men who are going to be the most vulnerable to the physical and sexual assault inside the house. We also have women who entered child, early or forced marriage as being more vulnerable to physical or sexual abuse. And we have daughters who are not attending school as more vulnerable to physical assault because they're in the house for more of the time where the abuse takes place. And then lastly, we have survivors who speak out are obviously at more risk of the ostracization that happens to those who speak out. So those are the kind of vectors and the parameters of vulnerability to those threats. In terms of capacities of people and groups to mitigate that threat or that risk, we have church groups who are providing in their pastoral services informal types of counselling and advice to couples as part of their pastoral activities. They have women with strong family or social networks who are able to provide support and guidance to survivors. And we have women with education who are able to provide advocacy towards the local leaders to reduce that ostracization. So then we have a log frame, again, entirely fictional. This is what you might set up in order to respond to those threats. I'm going to walk through this log frame briefly the wrong way round, right? I'm going to start with the activities and then walk towards the outcomes. So it's essentially 3 types of activity. One is training with faith leaders. The other is training gender champions. And then the last is community action teams. So let's take the faith leaders as a training of 12 different faith leaders across 12 villages, looking at equality and non-violence. The expected outputs are the discussion, the fact that these faith leaders go and discuss gender equality and non-violence in their prayer groups. The incidence of faith leaders supporting survivors. We expect to see them supporting survivors and challenging ostracization and reporting, encouraging reporting or access to services. And we expect those things to lead to an increased community-wide acceptance of gender equality and non-violence, reduced ostracization, increased access to services, and increased reporting. And those changes, those results, we expect to see yielding a reduced IPV risk and a reduction in the harmful effects of ostracization. So that's all stemming from the work with faith leaders. And then the work with gender champions, the idea is we'd be training up to 30 gender champions in each village, covering IPV, power status, gender norms, conflict resolution. What we expect to happen as a result is gender champions conducting community dialogues in each village, which should, we hope, lead to an increased capacity to resolve the conflicts through non-violent means and reduced acceptance of IPV amongst men and boys. And those things would hopefully lead to reduced IPV and support the reduction in ostracization. And then lastly, we have community action teams being established where we would hope that they would go out and raise awareness and challenge harmful beliefs in a certain number of community settings, and provide support and guidance to survivors in each village, which again, we hope will lead to a reduced acceptance of IPV and increased resilience of survivors, leading to those final outcomes. So that's the imagined project in response to the imagined risk that we described. The question is, how would we do the outcome harvesting for this project? And so I'm going to walk through the 5 steps now, using that to pull out some examples. So to give you the first step, number 1, design the harvest. It doesn't need to take too long, but it does need to be done with a concerted effort. So the first thing to do here is to choose a question. That means choosing not a normal evaluation question that covers the DAP criteria of relevance and effectiveness and efficiency and all the rest. No, what we need is a question that focuses in on asking what has changed in the community and how. So these are examples that you see on the screen. It's common to have 2 or 3 different questions in a single outcome harvest. But really what you need to do is make sure they're clear questions. So these questions are important and I'll walk through them. How have the behaviors of male household heads towards their partners and children changed since the program started? So see, it's clear I'm asking about a particular group of people, male household heads, particular behavior, their behavior towards partners and children, and a particular time frame since the program started. So all of these points are clear, and I'm asking, how has that change happened? Tell me more about that change. The other questions are similar. So how has the program helped to reduce the ostracization of women after reporting IPV? How have attitudes towards IPV changed within villages since the program started? Has the program contributed to improved capacities of women to access support and services? They're different because they're asking about different parts of the log frame. So some of them are about accessing support and services. Some are about ostracization. Some of them are about behaviors of men towards partners and children. And they're different because some of them are contribution questions. So question 2 and 4 are about how the program contributed to a change. Question 1 and 3 are just about what changes have happened and how, right? They're all fine. And you might want to have 2 or 3 of those in an outcome harvest so that you can cover a wide range of topics. But they're all clear on the change, the particular change they're asking about, who did that change? Who is it that has changed? When and where is that happening? That's what's key with these questions. Once you have those questions decided, you then need to clarify every single term, and you need to do this so that an outside evaluator can come in and be very clear about what ostracization means with examples. What are we talking about? What counts as an attitude towards IPV? How do we draw the line between an attitude towards IPV versus an attitude towards gender as a whole? We need to draw those lines so that someone can review documents in order to assess if it's an example of a change in attitude to IPV versus something else. What counts as improving the capacities of women to access support and services? All of these things need to be defined very clearly in that first step. And then lastly, we need to identify what data we're going to collect to answer these questions. So this means broad net, what types of reports, stakeholders to speak to, program reports, needs analyses, anything. What will you be using to answer the question, who changed? What did they change? When and where did it happen? How does that link to the threats, vulnerabilities, and capacities in the risk analysis? And how did the program influence those changes? Those are the things you need to answer. So in step one, you need to stand back and think about all the potential sources, all the people that could tell you about that, all of the reports that might tell you about that, so that you have it all in a big basket to begin the outcome harvest. So that's step one. Step two is the actual work. So it's the gathering data and perceptions. So here, what we're looking at is getting a good sense of the secondary data and then going out to reach the primary sources. So first step is review the secondary data. We're talking about looking at program data, output monitoring reports, needs analyses, cluster reports, a wide set of surveys that you might have done or others might have done, academic literature, everything, and using a very clear and consistent harvesting tool that I will come on to on the next slide that can help you to ascertain and understand what changes have happened and how your program has contributed to them. So you ask your evaluator to go through each of these reports and to not give you much more detail than simply forming outcome statements about what has changed and where they found evidence of that change. That's all they're doing. So it's quite a simple task, but you have to do it consistently across all of the reports you look at. Once that's done, we would then reach out to primary sources. So at this point, we're not talking about the community necessarily. Very often this gets done with just internal program staff. I don't think that's ideal, but if that is the case, you want to have the focus on field staff who are engaging with the community, who will be able to answer questions about what's changed in the community. If you are hopefully engaging community members, then you need to make sure that they're sort of close to the program. So they're people that will know about what has happened and what the program has been doing. So things like the gender champions that were trained in this log frame would be ideal people to reach out to. The reason why we're doing that is we're not at the evaluation stage yet. What we're doing here is getting clear about the outcome statements, what we think has changed. And so if you have an evaluator looking at your monitoring reports and then going out and asking the gender champions or the faith leaders that you trained, is this true? Can you give me more information? Can you clarify it? Then they're going to help you get a really good sense of how to make those statements as clear as possible. And so it's just important to say at this stage, we're not doing the verification, we're doing the data collection. And so when you do this work as an evaluator, and if you're employing the evaluator, you need to insist that they act as a facilitator, not as an evaluator at this stage. What they're doing is working with your program staff and working with your documents to try and draft, comment, redraft, perfect these outcome statements. So you have very crystal clear statements of what has changed. It's actually quite hard work, and it requires a facilitator mindset, not an evaluator one. You don't want to be saying that's not relevant or this isn't important. You want to be just clarifying the detail of what's being said. To give you an example of how you would do that, this is actually taken from Ricardo Wilson-Grau's book, which was probably blurry when I showed it to you, but that's the title of the book at the bottom of the screen there. It's the most recent work that outlines this methodology in detail. And in there, he gives you a very clear instrument for collecting this data. It's adapted, but it's essentially the same as what you see on the screen. really you have this could be done in a Word document, and you might want to have a one-page introduction that says to people that you're interviewing or speaking to what you're doing. And then on the next page in that document, you want to have a grid, and that grid shouldn't be too big, but every row should have space for one individual outcome. So you want your evaluator to read all the documents and say, all right, here's an example of who changed what, where, and when. And that goes in the outcome box. And then the significance. Why is that important to GBV prevention? Because it might not be clear, so you need to clarify it. And that's about relating it to the risk analysis. The contribution, how did the program help to bring this about? Is there any evidence of that in the reports or in the conversations with faith leaders or gender champions? And then lastly, what are your sources for that? So to give you an example of what that might look like, in our project example, you might have something like this. Over the final 3 months of the program, so that's when did the change happen? Men in the targeted villages, that's who, started to reduce their use of IPV. That's what they did differently, right? So we've already got who changed what, when, and in these targeted villages where, right? So already that's quite clear. They started to reduce their use of IPV as a means to manage disputes in the household, demonstrating increased ability to use non-violent dispute resolution and to talk about their problems with male friends in the community. Right. So that's the outcome that you get from all the reports and all the conversations with faith leaders. What's significant about it? Well, we know from the risk analysis that the domestic disputes amongst households with socially isolated male heads were the primary trigger, primary flashpoint for IPV. And so what we're saying is that the change that we saw here was a reduction in the use of IPV following disputes in the household. So clearly it's relevant to that. And also an increase in the ability of men to talk about their colleagues, talk about their problems with their friends in the community. So in a sense, it's an overcoming of the social isolation. It's borderline, but it's relevant to social isolation. So we've got an outcome statement that's very clear, a significance that relates it to the risk analysis, and then a contribution. So what we've done here is look through the monitoring reports and seen, is there anything that we know you did in your list of activities done that contributed to this outcome? So the example here is, okay, well, we trained 27 gender champions per village. They spoke to, or they had 123 different dialogues with the community. And the champions themselves said that the training that your program did helped them to discuss causes of IPV, build capacity of households to manage disputes in a non-violent manner, right? So what we've got here is a bringing together of what you probably get from discussions with gender champions, reading and monitoring reports, a combination of different things that explains how your project helped to bring about this outcome. To be clear, this is a qualitative assessment. It's about the perspectives of your monitoring reports and your gender champions. It's not an experimental trial where you can prove that this is an attribution to your program. It's a qualitative assessment in a non-experimental manner of the contribution of your work to this outcome. But it's still quite rigorous because of the way, if you do it correctly, the way that you've gone about this in terms of building the specificity of that and speaking to the right actors. So that's an example of what you'll get in one row of this column, right? And so for every outcome statement, you want to fill that in and get quite a large grid of data at the end of it. Once you've done that, a good way to think about this is to say, well, the evaluator will look at the secondary sources and the monitoring reports and fill these in, and then they'll want to go and speak to your gender champions or your faith leaders to get more detail. So the kinds of questions you'll be asking them, or they will be asking at that stage, is, can you help me get more specific? What do you mean by reducing the use of IPV? What types of IPV? Can you help me verify that men were talking about their problems with community members and not just talking about something else? Can you tell me if this significant statement is accurate, or have I missed something in my understanding of the risk? Are the numbers correct? Can you share any kind of feedback surveys about what gender champions said? So basically, in this step where you go to the primary sources, you're just asking for greater detail and greater specification to make this whole statement more solid. So that's step 2. Step 3, you then need to substantiate the outcomes that you've got so far. So that means finding a selection of these statements. So here you have an example of 6 different statements. They're far too short, these statements. You need much more detail, but 6 different statements. You take a sample of, let's say, 3 of them, and then you verify whether these statements are correct or not, whether they need further nuancing. The way that you verify is you reach out to community members who were not program team members and were not closely related or taking part in the program activities. So not gender champions, not faith leaders, people who are perhaps interacting with faith leaders, or people who perhaps saw the gender champions doing their work, but not people that you've directly influenced in your program. It's the indirect population, right? The people that you're hoping to, for whose lives you're hoping to change. So when you've identified which statements you need to verify, you need to make some kind of selection approach to interviewing such people, running focus groups or workshops. Of course, ethical questions and methodological questions about how you make that selection are big and important, and you need to look at some of the background literature on how to do that. But really you want to focus on choosing community members, looking for peer groups of vulnerable people. Perhaps if you're worried about minors, you might want to speak to teachers that work with the minors or social workers that work with the minors who are close to people who are able to explain the risk without perhaps re-traumatizing. And then make sure that they're not people that are directly stakeholders, directly influenced or involved in the activities of the program themselves. So that's the verification step. The important thing is to separate that step from the first one or the first 2. You don't want to try and run the verification with the collection of statements. Collect all of your statements, get them as good as you possibly can. And once you've got that grid, make a selection and start verifying. If you merge these steps together, you run the risk of reducing the credibility of your findings. Step 4 is to analyze and interpret the statements that you've now got. So you should have some pretty solid statements, number 1 to 6. You think you've got something that you can stand on, something that's quite credible. You need to understand how are you going to use these statements to answer your question. So there's a couple of steps there. The first is to try and use the risk analysis to help guide your conclusions. So the statements that you've got here, are they an indication that the threat has gone up or down, or the vulnerability or the capacity of communities has gone up or down, right? So here, if you've got a statement like, well, we saw that IPV use has been, so there's less use of intimate partner violence to manage disputes in this village. Well, that's about the threat. The threat has gone down in that case. Increased access to service and support, well, you could say that vulnerability has gone down, or perhaps capacity has gone up. You might want to look at increased reporting of IPV. That's a clear growth in capacity, or reduced vulnerability because girls are attending school more, which is moving them away from the place where the threat is taking place. So the point is, for each statement, we're analyzing it in terms of the threat, vulnerability, or capacity of the individuals and communities to mitigate GBV risk. And if we do that, then we can start to understand how we can use them to answer the question. And if you take a question here like, has the program supported a reduction in IPV risk in these villages? You'd say, well, yes. Why? Because it's reduced the threat, it's reduced the vulnerability, and it's increased the capacity to respond. And you can explain how it's done so in quite a meaningful way using the outcome statements. The last point to add is that unintended changes are important here. So there may be, your activities might not have focused on getting more children to school, more girls to attend school, but that might have been something that your stakeholders told you happened. Well, make sure you include that. Don't throw it out because it's not in the log frame. Keep it in your analysis, because that will be really interesting information for project teams to learn from when designing the next program. So that's step 4. Last step is to make sure you use the findings. It sounds obvious, but the reason why it's important to treat it as a core step in its own right is that all the work you did in steps 1 to 4, it was work to ensure that your evaluation method has a learning orientation, right? It's not just about providing accountability to donors. This is about really learning about the changes that are happening in quite complex contexts. So if you go to the trouble of doing all of that and then you don't support the use of that learning, then it was a bit of a waste of time. And there are obviously ethical risks to doing this work. So you need to make sure that the feedback we get from these types of tools is fed back into decision making. So of course, as a separate step, make sure you share the findings with people who have the ability and the power to make changes in the program, or perhaps design a better program in the future, or think about targeting in the future. People who have that decision-making power should be engaged in the dissemination of findings so that they have the chance to do that. Emphasize when doing this unintended consequences or risks that weren't identified in the risk analysis so that that can be overcome. And then discuss how the harvest has led to learning, right? How has it added to your understanding of what works and for who and in what context? Very important in an area like GBV prevention, where I think it's fair to say we're still learning about what works and how that applies in different contexts. So make sure that there's a discussion of how this outcome harvest has improved our understanding of what works in the type of prevention that we're trying to achieve in the type of context in which the program was operating. So those are the 5 steps. And I'm sorry, it's very, I've just thrown all of this at you. What I would like to do is hand over to all of you now to go into breakout rooms where we're going to have a simple exercise, very simple. You're going to join a mural group, and Ife, I'm going to ask you to put into the chat now the individual groups, so everybody knows which breakout group you're going into. So if you can look at the chat, you should be able to see your name and it should tell you which group you are going into. And then once you have your group name, which will be a fruit, once you have the name of your group, the fruit of your group, you should then get a link to Mural, which is a sort of a white space, online white space where we can do this exercise. So don't worry, just focus on finding the breakout group. And once you click on the links to Mural will be in there as well. But really the most important point is to find your group and then click on the Mural. And what we should be able to see is a space where you can draft a fictional outcome statement and a contribution statement for the program that we've been discussing. So what I want you to do is to look at the log frame that I'm going to you will see on the Mural board. It's the log frame that we looked at earlier. And I want you to choose an outcome level change that you might expect to see for that program. You can also, if you don't want to use the log frame, you can use the monitoring reports or the interview fragments that are in the background document that I sent to you. So then I want you to try and develop just one outcome statement in your group. So that needs to say who changed what, when, and where. And so if you could do that using the sticky notes on the board, then that would be great. And then just, if you have time, try and do an assessment of why it's significant and how the program contributed to that change. And then lastly, if you're going really well, try and tell us whether you think that's linked to threat, vulnerability, or capacity, or perhaps it's an unintended consequence. So this is what I want you to look at. It's really just drafting your own outcome level change and then doing the work of looking at significance and contribution and where it sits on the risk analysis. So that's the task. Thank you. So just to say to everybody, I threw a whole bunch of information at you that normally, I don't know if you can see this book or not. I mean, this book is long. Trainings on outcome harvesting can take a week if you really want to do it in full depth. I threw all sorts of terms at you and then asked you to just go ahead and do it. So really, really hard. And I also appreciate that we've thrown Mural at you without an introduction. So first of all, if you are struggling with any of that, don't let this put you off the methodology. The point was to try and get you grappling with what makes an outcome statement an outcome statement. And from switching between the groups as I did, I saw you were all getting the hang of that. And you're then starting to address questions about, well, what does significance mean? And how do we assess contribution? All of which is really advanced for 90 minutes of however long we've been looking at this. So first of all, just to say, I totally understand why that's challenging. But what we'd like to do briefly is just have a brief discussion about what happened. There are, I think, too many of you to go through group by group and everybody to display what you did. And I think it was almost too hard to do that. So let's just pick one group randomly, get you to share that group. If you're the lucky group name that comes up, I would ask you to just to share briefly what you put, and then talk us through your thinking. And then if we have time, we can get another group to comment on that or to compare to what they've got. So really the point is just to facilitate a discussion about what we were doing more than anything else. Ife, I'm going to pass to you to spin the wheel of fortune so that we can pick a group. So I've stopped sharing for that purpose. Over to you.
Perfect. I'm about to share my screen. Can everyone see my screen? Perfect.
Yeah.
Perfect. So everyone's been randomly assigned to this random wheel of fortune. I mean, each group with the fruit names. So I'm going to go ahead and spin to see which group we'll be sharing first. So papayas will be sharing first. Any representative from the group?
That was the group that I was in. It would be great if, since I represent interaction, it'd be great if somebody else speaks on what we managed to accomplish in the group.
And so just to be clear, we're just looking for someone to say roughly what you got in terms of an outcome statement. If it's possible to share your screen, that would be fantastic, so we can take a look. But really just a quick presentation of what outcome statement you got. I don't know who was in the papayas group, Jessica, so I can't call on people.
Yeah. We had Jacqueline, we had Claire, and we had, if I say it right, Zura. Do any of you want to talk?
Sure. Yeah, I can. This is Jacqueline.
Okay.
I
can share the screen while you talk because I know you can't do that. Can you all see the screen?
It looks really good. You've got lots of outcome statements already. Really encouraging.
We spent a long time on the outcome statements.
Great, great.
If you want to talk through them.
Perfect. Yeah, so actually I think they're almost color coordinated by mistake a little bit, but the first three are really about an increase in women and girls seeking services for IPV experience, whereas the last one is an example of, try not to get ahead of myself in my language, but basically an example of a reduction in threat in the sense that it's men and boys reporting hearing less cases of IPV. And then we hadn't got too far after that, but we took some time to look through the activities and the outputs to think about, again, this is a funny process of going backwards, but to think about which of those activities and outputs would have had a most likely impact on those outcome statements. And we were honing in on our outcome statements 2 and 3, which were really about people seeking services or seeking or accessing referral pathways more often and in more numbers than they had before. So we'd also paid attention to make sure that we covered the who and the what and the where. So yeah, that's as far as we got. And then we were really just working on the framing of the contribution. But the idea was that our activities of training gender champions was leading to this increased uptake of support services for women and girls. And then we ran out of time. I don't know if my colleagues in the group want to add anything more than I might have missed.
No, I think that covered much of what we
No,
went
I think
through.
we covered it all, yeah.
That's really good. Guys, I'm really impressed by that. I think you've got, I'm going to jump in. I'm going to use my sort of, I don't know if it's a right, an ability to jump in and just to say that these outcome statements are really interesting. So you've clearly identified who it is that changed and what it is that they changed and when. And that's what's really strong. You've got some clear statements here of changes in the community and in the lived experiences of people in the communities you're dealing with. So it all looks really strong. I don't think for outcome statements you need to just say things like the focus group said this, like you don't need to be at that level, but that's, you know, a very minor detail and not really for now. The point is that you're describing that, look, men or boys did this or women did that. The phrasing there, the use of, essentially, to be grammatical, the use of active sentences is kind of a core point of outcome harvesting, because it means you're forced to say who did what. And that's what you've done really well. So I think that you've got some really strong outcome statements here, and quite a few of them as well. So I appreciate you've obviously used your imagination to some, you know, to pick out all the different pieces in the log frame and other areas. And then on the contribution, I think that's also really strong. So you're starting to think about what aspects of the program in the reporting document can link to particular outcomes. If you had more time, you'd be looking at trying to do that for each outcome statement, and then also to look at significance. So we are a bit pressed for time ourselves, but Ife, can I ask you to spin the wheel one more time? And we'll just get another group in to say either what they thought about that, or if they had any comments on significance, because that's quite a hard thing to get your head around. So over to you, Ife, spin the magic wheel.
Absolutely. Blueberries, the blueberries group.
Blueberries, lucky blueberries. So blueberries, is there anybody from the blueberry group that would be happy just jumping in and either sharing their screen to tell us what you did, or just commenting on what you saw there and your experience of developing these outcome statements? Again, I'm afraid I don't know who's in the blueberry group. Does anybody want to jump in? Raise your hand, turn on your camera so that we can hear your thoughts.
Yeah, I think maybe I can represent instead of our group.
Thank you. Thank you. Please do. So what were your thoughts about what you did?
Yeah. First of all, we can only finish the one outcome statement and significant and contribution for the time being. Our outcome statement is that in the last 6 months of our program, the women engaged in our targeted area started to change in their belief in justifying the white beating. It's change in they disagree about the any violence to women in any specific situation. That is our outcome statement. And what is the significant is like we can see the change in the perspective of the gender equality, and we can see that women and men are sharing their responsibility in the household. That is came from the group that we found in the community as part of our program implementation to resolve this outcome change, which are like maybe the peer group, mother group, man group, and also we train on them, and then they share all like gender equality and women rights with other peer-to-peer in the community. In addition to this, we also thinking that we need to do the advocacy to the community leader and stakeholder, and also community and man engagement activity is essential to reach our to reach our outcome statement. Yeah, we can only finish only one outcome statement and related further. Yeah.
Don't worry, with to complete one in its entirety is really impressive. I would say very briefly, I love this, what you've got here. So again, you've got real good clarity in that outcome statement. You're using the active description, the active voice, right? You're saying that women and men in these areas started to change their beliefs. The kinds of things you'd look to do when working with an evaluator who provides you with something like this is ask them to break that down and say, well, what changed in the women's belief about this? What changed in the men? To try and sort of disaggregate that a bit. On the significance, this is really good, and you want to try and link it to the risk analysis. So that's the kind of place where you want to bring in the risk equation and start saying, well, part of the threat that we saw is related to people's beliefs about wife beating as opposed to other types of GBV, right? So it's identifying that those beliefs are actually part of the threat system that we're trying to address that explains the significance to the work. But that looks really strong, and the contribution is really good too. So guys, I'm really impressed because it was such a hard task. You had so much to pick up in such a short amount of time, but it shows that I think we're getting a good idea here about outcome statements being about what's happening in the community, significance being about why that's important for the risk that we're trying to address, and then the contribution being what did our program have to do with it. So it's challenging for us, certainly as an evaluator, to look at contribution last, but in a sense that's what we're being asked to do. Okay, this was really strong. So I propose what we do now is move on to the next session. I'm just going to talk through some of the organizational requirements that you need to have in place in order to do this well. The first of which is having someone who knows how to share their screen. Let me see. And then the other thing I think we should do is just go back for another exercise where you'll get the opportunity to sort of, I'm basically repeating the exercise in the sense of asking you to think about outcome statements again, but instead of making you do all the work, in session 2, we have some pre-prepared ones, and I want you to assess them and tell me what's good or bad about them, because some of them are good, some of them are terrible, and we can look at that. So, organizational requirements. Just quickly, Jessica, can you give me a thumbs up if you can see the screen and you can hear me and it's all good?
Yes, it's all good.
Wonderful, thanks. So what do we need to have in place in order to do this and do it well? There are lots of different things, and again, I would advise you to look at some of the literature that we referred to in the background documents. There are lots of things you need to have in place, and I think there are some challenges around doing this in the kinds of context that we work in because of the time constraints that we all face. However, I'd say there are some core things that we need to think about before we agree to do this, and it's to do with the openness of the organization to hearing these pieces of information, these outcome statements. Now, I don't mean to be patronizing, essentially, because all the work that we do in GBV prevention requires organizational openness, and all evaluation requires openness to learning. But I think there's something about outcome harvesting that sort of requires us to go even beyond that. And the thinking here is the following. Firstly, it's that we need to be open to potentially changing our understanding of what causes GBV in the context that we're operating. So I guess we don't need to think about global theories about what actually causes it, but we might have to amend and adapt our understanding about what the driver of violence is in the context that we're working in, and what works to prevent it. And the reason why we have to be open to changing our understanding on that is that, like I said, we're going to the community and we're saying what changed over the last 3 months, and they might throw up something we weren't expecting. For example, that project, that log frame that we had, it didn't have anything in there about girls attending school. But you might find that when you go out and ask people what's changed over the last 3 months, they tell you about that, even though you weren't expecting it or asking them about it. They might tell you that. And the key thing is to be open to hearing that and ask them why that matters, and to then hear what they say, because they might be saying, well, actually it was having girls at home that exposed them to violence. So the fact that we've got more of them in school is great. You know, so you might learn something that you didn't know before. So being open to changing our understanding in context is really important. The other thing is being open to learning that doesn't map onto our log frame or our theory of change. And then also being open to having community members assess what we've said. So if the evaluator comes along and gets an outcome statement that's formed by the head of country office or somebody with power, and then the community members say, no, I'm sorry, that simply did not happen, the organization needs to be ready to hear that, because if you're not, then there's no point in doing this in the first place. And again, I don't mean to be patronizing, because I know that this happens a lot anyway, and that obviously we're all quite open to this kind of thing. But with something like outcome harvesting, it can be quite confrontational, because you're directly asking people, did this happen in this community over this time frame? And sometimes the answers are not what you expect. So we need to have quite a degree of openness to that. The last point is that you need to be able to invest time in it. On that point, how much time? The answer is it depends. But what I've got on the screen is taken from Ricardo Wilson Grau's book. It's adapted, but it's an example that he shared. in terms of budgeting time for an evaluator, so there's more details here about the time for the organization and the amount of work that you guys would have to do in commissioning and managing the evaluation. But just in terms of understanding how many days it takes to gather and analyze this data, the estimate that Dr. Wilson-Grau gave was 34.5, which is a very precise number, but it's an example on the basis of the calculations that we're going to walk through. The learning to take from this slide is not 34.5 days. It's understanding how to assess the amount of time that it's going to take you to do outcome harvesting. So Betty mentioned doing outcome harvesting in a project that's coming to an end now. Well, I would encourage Betty to look at this slide and think, well, do I have time to do this step, and this step? And the way that Betty would want to do that is to look at step one and say, well, do I have a few days for the evaluator to hold interviews and discussions with the program team and ask them what are the questions they want to answer, and then narrow those questions down to 2 or 3 and make sure that they are very precise in the way that we described and very clear. So defining all the terms. That's going to take a few days, and you need to do that before you start doing data collection, otherwise it doesn't work. So do you have a few days to do that? For step 2, the answer is it takes us, it's as long as a piece of string. So in the example that Ricardo shared, he's saying, well, if you have about 200 pages worth of data to read, and if you have about 24 people that you want to speak to clarify the outcome statements, and if you're looking at roughly 5 areas of outcomes, then it will take probably around 18 days. So that means how much time does it take to read those documents, do like a 1-hour conversation with each of those 24 people for each of those 5 outcomes. So that's 5 hours per person. And then tie all that together and get good outcome statements of the type that I asked you guys to do in 20 minutes, right? So Ricardo takes 18 days to do that. So that's on the basis of about 200 pages of document, about 5 outcome areas and about 24 people. Your project might look different. You might have different numbers. You might have more data or less. You might have more areas of outcomes or less. So you need to think about that in terms of the data collection stage. 18 days is a lot of time. It's going to take, it's a month basically of sending an evaluator out to do data collection. The next step is to think about the substantiation. So if you're looking at 20% of your total statements, so here the total statements are 1 outcome statement per outcome area per person. 24 times 5 is 120. So you've got 120 lines in that grid where each person has given you a version of that outcome statement and you verified it. Then you want to go and substantiate it with 20% of them with people in the community. Well, again, that's going to take some time, not that much time, because you're just doing a short discussion with a few community members, but I mean, with community members, but still you need to budget half a week or so to get that done. Step 4, how to go about doing the analysis. Well, that's really core evaluator time. That's when you take your facilitator hat off and you become an evaluator and you relate it to the GBV risk equation and you go through and think about the answer to the question. It's 7 days, 5 to 10 days, something like that for a project of this size. And then lastly, a workshop, a half-a-day workshop where you have to prepare it and do the follow-up. You need to think about a few days for that. So that's how you end up at a figure like 35 days. But I think it's just worth remembering that if you're planning to do this, you need to break it down line by line for each step and have a sense of whether you've got time to do this. And if not, do you reduce the amount of outcomes that you're looking at? Do you reduce the number of questions you ask or the amount of data you use? You have to think in those ways to make sure you've got time to do this well, because if you don't do it well, it can lead to quite poor quality. So when do you do it, given everything that we've just said? I mean, there's different ways to look at this. One is that there's a strength of outcome harvesting. You don't need a really good monitoring system. It's better if you have one, but you don't need quarterly reports that you can then rely on. You don't necessarily need a really strong theory of change. So it's not like other methodologies where if you don't start planning for the evaluation when you design the project, it doesn't work. It's the opposite of that. Betty could use this at the end of her project. She could just jump in and say, all right, we're going to use this to collect data. However, you do need to be able to make sure you do it soon enough so that the memories of people you're speaking to are fresh, because obviously this relies on people telling you what's changed. So if you do it too late, the memory effects start to ruin the credibility of the findings. Obviously, you need staff to still be in position. So you need to be doing it in quite a short time frame with respect to the project cycle, not too far away from it. And you also need to bear in mind that you guys work in humanitarian agencies, so you have really short project timeframes. That means you might want to start planning this, at least thinking about the step one before the end of the project, so that you're not getting to project end and you still have 35 days worth of work to get through. You might want to try and plan, decide what your questions are, define your terms, start thinking about the types of data that can be used and the people that can be spoken to, so that you can hit the ground running when you begin. And that point, I think, leads us to this last point here, that I think there's a question here about where this is done and at what level. Because if you tie it to individual projects, in a sense, that's perfect for the tool, because the tool is well designed to look at individual changes in a particular household or a particular group of households, or a village. And that relates really well to single project level. But the trouble is that the planning and the time that's needed to do it well can make that difficult if your project is 12 months, 6 months, or 18 months long, right? So you might want to think about using outcome harvesting for 1 or 2 projects together in a similar area, working on a similar type of activity. It can get difficult if you use a large portfolio of projects and you have different types of activity. But if you've got some degree of sort of similarity and some continuity between the projects in a particular, let's say you've got 2 projects running in South Sudan, one in Warrap State and one next door, maybe you can try and do an outcome harvest together, in which case you want to be at least doing some of the strategic thinking at country level rather than just at project level. And that can allow for slightly more strategic timing around doing step 1, identifying the questions you want to ask, thinking about the evaluators you want to use, doing the project planning, getting the budget in place. Stuff like that can be done slightly more strategically if it's divorced from an individual project timeframe. But of course, to do that, it requires having a strong meal capacity at country office level who can support that and help you think that through, so that it's useful and it's tied to project results at the end of the day. So those are the main thoughts on sort of what you need to have in place. There's lots more, and I would really encourage you to look at some of the background documentation on this. The other critical point is that you need to have yourselves, you need to have good meal teams and good GBV advisors who are capable of looking at an outcome statement that an evaluator might provide and saying, sorry, that's rubbish. Like that's, you know, that's not, you haven't identified who's doing the change, you haven't identified what the change is, or this needs more work when you tell us why that's significant. You haven't really thought through the threat, the capacity, the vulnerability. You need to be able to critique the quality of the work that's coming to you. And that is quite hard, and it takes a bit of practice. So some of the background literature has examples and things you can look at. But I want to do one more breakout exercise before we do the wrapping up. And this is hopefully easier because you just need to critique what's on the mural. But if you go back to your groups, so I think I'll hand over to Ife once I've just finished explaining it. If you go back to your groups, the same groups as before, what I need you to do is just to think through at the bottom of the mural. So if you scroll down, at the bottom of the mural, there's a section that says breakout exercise number 2, and it's on interpreting the data. So in that section, you have the risk analysis. I've got the threat, capacity, vulnerability, taken from the example that we saw before. And then I've got 9 different outcome statements. These statements are of varying quality. Let me just see if I can share this. Maybe that would help. Jessica, can I give you a thumbs up? Can you give me a thumbs up if you can see this mural?
We don't see it yet.
You don't see it. Well, 1 second. Let me stop and start again. There we go. How about now?
Yes, small, but yes.
Great, that's perfect, thank you. So small because that's the big picture. You've got, as you saw before, the fictional project, some outcome statements, and then down here in breakout session 2, we've got interpreting the data. You can zoom in on that on your mouse, and you'll see the risk analysis, the threat, the vulnerability, and the capacity, and the 9 outcome statements. Really, what I want you to do is just look at those outcome statements, choose 3 that you think are strong, and just talk amongst yourselves about why they're strong. And then think through, perhaps if there are some that are weak, think through how you could improve them, or even the 3 that are strong, think about how you could improve them. So improve the precision of the outcome statement, or maybe add a contribution statement if one is missing, or a significant statement if one is missing. Just think about how you could improve them, and then tell me whether you think that outcome statement relates to threat, vulnerability, or capacity using the description that you have in the risk analysis here. So just pick 3 that you think are strong, have a discussion about why, how you can improve them, and then relate them to the risk analysis. And then afterwards, we'll just have a discussion about what we thought about the statements and their strengths and weaknesses. It's terrible, isn't it? I give you a really complicated task and then like 10 minutes to get it done. I know, it's frustrating. It's a teaser. We're trying to get you guys to be interested in using this again. So let's keep it short. So hopefully you had a chance to kind of look at some of those outcome statements. There were lots there, and they were quite varied. So some of them had a lot of detail, some of them not very much. It's absolutely okay if you didn't select 3, perfect all of them, and allocate them all to the risk analysis. But what I'd love to do is have a very quick chat about what you saw when you looked at those 9. So Ife, can I ask you to spin the wheel of fortune, and then we'll ask one member of the winning group just to tell us what they learned, really, in terms of the outcome statements that you saw. Maybe you have one that you thought was really strong, or one that was really weak, or one that you understood how to relate it to the risk analysis. So just to share your thoughts on that. Ife, over to you.
Thanks, Neil. Here goes the fortune. The mangoes group. I think that's group 3.
That's excellent. We haven't had the mangoes before, right?
I don't think so.
No, I don't think so either. So mangoes, is there anybody from your group who would be willing to share your thoughts about the best or the worst, and how it related to the threat analysis?
Yeah, I can start, and probably the others can join in and add. We actually didn't get through to all the statements, so we looked at, I think, 4 or 5 of them in the time, and yeah, so we pretty much found that they weren't specific enough. So questions remained open, like the when, who, and the what exactly. And yeah, sorry, we didn't get any further than that, but it reminded me a lot of creating like M&E plans, like who does what, when, and how.
Yeah.
So all these classic questions, right? Maybe my my colleagues would like to add other thoughts.
Yeah, when we're going through some of the outcome statements, some of the language was vague. Like there was one which talked about challenged religious leaders, challenged traditional leaders. Then you start to ask yourself, what do you mean by the word challenged? And some of them had the word support. Support means different things to different people. So that's what we're mainly talking about in terms of improving the outcome statements.
Thank you, Maren and Budule. Thank you. Cassandra, you're also in that group too, if I remember. Yep. Anything to add to that?
No, nothing to add. That reflects what we discussed.
Great. Then thank you so much, Mangoes. I totally agree with what you just said. So some of these are vague. They don't do a good enough job of saying who changed their behavior. So, I mean, just saying men is quite vague, right? We need to know a little bit more about who and which groups of men and what they had to do with the threat presence in the first place. Some of them, you know, they do try to give that detail. So we talk about faith leaders, or we talk about particular groups in some cases. You know, there's varying levels of specificity, and ultimately you have to get as specific as you can in the time that you have. So, you know, we need to bear that in mind when pushing evaluators to tell us more detail about who did what. We need to think about, well, what's the useful learning here? I think that some of the examples you got there are quite vague. As you mentioned, Buthelezwe, you said, you know, it wasn't clear what the change was. You know, a reduction in IPV, okay, or an increase in capacity, right? But what does that mean? Concretely, what's the change in capacity? So you'd want to get more detail out of those. So that was really strong. So thanks for those comments. Can I just check? Can we go for one more spin of the wheel before we do the wrapping up session, to see if we can get another group to tell us a little bit about what they thought about one of the outcome statements, and perhaps how it related to the risk analysis. So I need to stop sharing my screen, don't I? Yep.
Here goes the wheel.
Great.
Papayas. I think you're on mute, Neil.
Thanks, Ife. Papayas, is there anybody from your group who could volunteer just to chip in and tell us what you saw when you looked at those outcome statements?
Anyone from our group want to speak up?
Jessica, I'm going to ask you to pick someone then, if no one's willing.
I'm trying to, was it Christine who jumped into our group, who suggested one of the ones that you felt was strong, if I'm correct?
Hi, yes, I was actually in the Melons group, I think.
Oh,
so
sorry.
It was Claire.
Yes, I jump in. Hi.
Claire, I nominate Claire.
Oh, I'm sorry. Okay, so go ahead, Claire.
All right, sorry. I don't know if I can remember everything though, but we picked 2, 4, 2, and 6, I think, or 4, 3, and 6.
Mm-hmm.
Hold on, please. Let me get the sharing.
Yeah. Or just...
Okay. Yeah. So we felt 4 was strong because he had the W's, and for 3 we felt it wasn't well specified, having all the W's that we needed to, and for 6 it was kind of broad, saying school attendance of girls has risen in the last 3 months. So it didn't have everything that we needed to make the real outcome. So we felt. Can you hear me?
Yeah, you went off, but you're back on. So outcome 6, you
right.
thought it didn't have everything you needed. Yeah.
Yeah, I'm sorry, my screen is blank. Okay, it's back. Okay, it's back. Yeah. So I also picked 2, saying faith leaders challenge village leaders, because it was specific for me. But generally we just picked 2 as one of our best, and then we felt 6 and 3 did not have all the specifics for us.
Yeah, no, that's really comprehensive. So, I mean, I absolutely agree with you. I think that 6, to take that example, it doesn't have enough. It doesn't have a contribution statement. It doesn't have significance. It doesn't tell you about what it's got to do with the risk analysis. And there's some questions there. I think 2 is interesting. And I think the big question is, how do we assess significance for these statements? So if you look at this one, we're talking about faith leaders and their role in challenging ostracization. So when we go back to the risk matrix, we see that ostracization was a particular threat that people were suffering when they reported this. So we kind of, I think you'd want to relate that to that threat and say it's a reduction in that threat, or a potential reduction in that threat. So that's where I would sort of categorize it. And so I just think it's worth kind of thinking through how we interpret that, because there's lots of ways you could do it. You could relate it to different parts of this risk analysis. And the point isn't, I guess, to try and be right or wrong, it's to try and think about what are you learning. So does this challenge anything in this risk analysis? Is there anything here that's not true because of what you've learned in those outcome statements, or anything that you now know definitely is true in these outcome statements? So I think it's just worth thinking through how we push evaluators to make these statements more specific, understand examples of program contribution, but then also to think about, labeling it as we did on that slide. Is this about increasing threat or reducing threat, or the same for vulnerability and the same for capacity? Because it's there that the real learning, the GBV learning, can take place. So I think it's worth thinking through that stuff. If you're working with an evaluator who's doing outcome harvesting, you really want to make sure that they don't skip that step, essentially. Right, so thanks all of you for pushing through with what were some really hard exercises. What I want to do now, very briefly, is just share my screen and give you a brief sort of wrap up of what I hope we can take from this session. It's been quite quick, even though it's 2.5 hours. It's quite quick given the amount of stuff that we've got through. So I just think we should sort of summarize briefly what we want to take away from this before I hand over to Kerry, who's going to give a heads up of some of the work that Interaction is doing beyond this particular workshop when it comes to working with organizations like your own on M&E for GBV prevention work. And then also to Ife, who will wrap up the whole thing, close it off, and send you the link for the survey to evaluate the quality of this workshop itself. So the big takeaways I hope you can take with you. Firstly, I think we need to just be aware that this is a tool about learning about changes in the community and then working backwards. If you were just to take one thing away, that's the key thing. So this isn't a tool for mapping what you've achieved in terms of activities delivered or outputs of those particular activities. It's not going to give you a percentage score on your reporting to a donor who particularly wants quantitative analysis of how many people you've trained, right? That's not going to be this. This is about saying what changes took place in the community and then looking for contribution analysis afterwards. It can help you identify unintended changes. So things like the number of girls attending school in our project example is a good example of an unintended change. It had nothing to do with the project, but it might be picked out when you have these conversations with people, because you're simply asking people what changed, right? You're not really saying specifically relating it to a project. You're just saying what has changed over this period. And then I would also say that it can be very useful if we can use the threat, vulnerability, capacity categories to guide the analytical work. So this is not something that comes from outcome harvesting, right? Outcome harvesting is a methodology designed for all sorts of different programs, and it's neutral about how you do that analysis. But with GBV work, I think we have a unique opportunity because we have this potential to look at GBV risk in terms of these categories of threat, vulnerability, and capacity. And if you work with an evaluator who's prepared to try using outcome harvesting in that way, then it can be quite powerful because you can help to understand the risk patterns that are in the context in question in quite some detail. So I'd really encourage you guys to work with evaluators in that way. As discussed, it does take time and it does take skill and it does take openness to try using these types of tools, but I think it can be done. And lastly, I would say that, like we said at the start, this isn't really the strength of this tool is not about understanding contribution, or certainly not attribution. It's about understanding what has changed, and that can be a learning process in itself. If what you want to do is say, how did we contribute to that change, you can go beyond the kind of contribution stuff that we were looking at in those statements and try to be a bit more scientific about it. There are tools for doing that, things like process tracing or qualitative comparative analysis. There's a million other ways to look at contribution analysis, and we'll look at some of those in the other workshops. There is more detail in those types of tools, on those types of tools in the interaction framework. But the point is that outcome harvesting often gets used like this as the first part of an evaluation process, mapping out what's changed and then bringing in another tool to try and understand how we've contributed to it. So it definitely works quite well like that. It can be combined with other tools. So those are the main points for takeaway. I should pass over to Kerry to flag the other work that Interaction is doing. So Kerry, over to you.
Yeah, thanks, Neil. Hi, everyone. I just wanted to talk for just a few minutes about a community of practice that Interaction is starting up. So following the launch of the GBV Prevention Evaluation Framework, the PEF, earlier this year, we will be starting up a community of practice for those who will be piloting it, who are actively piloting it now or in the next few months, or who plan to over like the next year or so. It will be open to all of those people. It will be for programmatic staff as well as M&E staff, of course. We will have, for the community of practice, there will be an online forum for discussion, and then Interaction, we will be facilitating regular calls that we can use to dive deeper into themes, topics, or questions that may be coming up. So the main objective really for the community of practice is just to provide a space for those who are piloting the PEF to connect with others who are using it, to learn from each other's expertise and different experiences, to discuss the methodologies and the tools that are in the PEF, this outcome harvesting being one of them, share challenges and successes that anyone is having in using the PEF or parts of the PEF, just, you know, be able to look for different opportunities to collaborate with others and share resources and other things. So the idea is really for this to be like an informal, a safe space to really openly discuss our experiences in using the PEF. So Interaction will be managing this, and then we will bring on specific expertise to also offer support as needed. Like, for example, the first few months, we expect to have an M&E expert available who will also be able to respond to questions in the forum and during the calls, and we could bring on others as needed, just depending on what people are sharing in the community of practice and what sort of support we think people would like. So the forum is going to launch in mid-January, and then we will hold the first call shortly after that, probably a few weeks later. So in the next few weeks, actually, I'll be sending around more information on how to join the community of practice for those of you who are interested. And then I guess if you have any questions in the meantime, you just feel free to reach out to me or someone else at Interaction. You should all have my email, but I can actually put it in the chat again now just to make sure everyone has it. So I'll leave it at that because I see we don't have much time. Back to you, Neil, or maybe over to Ife.
Thank you, Kerry. I just want to jump in before we pass to Ife. And firstly, just to check with Ife, is it okay if we run just 1 minute or 2 minutes over time, or will the Zoom meeting suddenly cut us all out?
No, we can go over time here.
Great, thank you. So I don't want to take up too much of your time. I just want to put the floor back to you all, taken on board what Kerry's just said about the community of practice, but also what we've learned today, and more broadly about the framework in general. Does anybody have any reflections that they want to share to wrap up, or any questions that you have about the work going forward or the future workshops? I just want to make sure you've all had a chance to raise any questions. So if you have a question, do drop it in the chat or raise your hand, turn on your screen, open your mic and shout at me. Up to you. Okay. Cassandra, that's a hand. Yep.
Sure. I'm just reflecting on, you know, supposing I'm designing a proposal, or I'm in the early stage of a humanitarian project, and thinking about what kind of like evaluation design or modality will I use to know whether my humanitarian project, you know, affected the outcome of interest, like whether prevention of violence or increase in gender equality. How would I decide whether to use, you know, outcome harvesting versus a more another standard form of evaluation, like an outcome evaluation, a pre-test, post-test kind of, yeah, what might be the case where outcome harvesting is a really clear use case versus traditional outcome evaluation?
Yeah, thanks for that, Cassandra. So we didn't look at selection criteria of methodologies at all. It's a big question. The first thing I would say is look at the framework. Interactions framework has a decision tree in module 4, where we look at the different evaluation tools, and that can help you guide to precisely answer the question you're asking there. What are the types of things that would guide that decision? In brief, what I would say is that, firstly, please don't take the lesson from this that outcome harvesting is the answer. We have to be agnostic about methodologies, right? We have to fit them to context. The situations in which it might be a good option are things like highly complex stuff. So if you've been in the community that you're in for the past 10 years, you know it really well. You know who the main actors are and what the risk. You've got a really good risk analysis that's kind of been tested and retested over time. It starts to have slightly less value because the real value is in learning stuff that you really weren't anticipating. So if you've got a new project, by contrast, or a new context, maybe it's an old project and the context has changed because it's in a complex setting or something like that, and there's a great degree of uncertainty, great time to use outcome harvesting. The last point I would say is that if part of your ignorance, if part of the things you don't know is what changes are happening, then that's the time to use outcome harvesting. It sounds sort of facile, but it's not, because sometimes you'll have a project where you can see changes happening. Specifically, I mean, really, if you're not thinking about GBV prevention, that often happens. If you're looking at a nutrition program, you kind of see the changes that are taking place. But what you don't know is how the cash contributed to it, right? That's a different question. So outcome harvesting is about understanding what has changed. It's not really about understanding contribution, more or less, So really, if you have a high degree of uncertainty and a lack of awareness of what's happening in the community, that's the time to try using outcome harvesting of all times. Joe, sorry, Cassandra, I hope that's a useful answer. Great. Joe also put your hand up, but then it's gone down. Is it still up? Do you still have a question?
She put her question in the chat. So she first asked whether or not the context of this course would be shared, but then also asked whether or not future courses, covering new topics, would this be a prerequisite course for those others? I think you can answer that quickly, Neil, or if you want me to, it's up to you.
Yeah, I feel like passing that to you. But I mean, it's not a prerequisite. I think there are other courses that we'll be looking at where you're looking at other tools. Some of those tools can be added to it by doing outcome harvesting, but you don't need to be an outcome harvester to use these other tools. So absolutely not a prerequisite. For the course, Jessica, on the Interactions website, we will be sharing a recording of this session. Is that correct?
Correct, yeah.
And the content associated with it and the background documentation.
Yeah. We'll also share the tools and the breakout exercises so that you can use them with your teams as well if you wanted to do that. In terms of the contacts who participated in this course, let us get back to you on that. It wasn't something we completely thought through, but I see that there was some really great networking going on and engagement across, particularly in the breakout groups. So it could be helpful, particularly if you all also join the community of practice, be a great chance for you to connect again and to really engage. So we'll come back to you with that in terms of additional resources that might be shared out.
Great. So I think what we should do is pass to Ife, because we need to share the survey before you all drop off. So let's do that. Ife, over to you.
Absolutely. Thank you, Neil. Thank you all for joining today's workshop. But right before we close, I just put in the chat a survey that, please do fill it out. It will help us sort of cater future workshops better. And if you have any questions, please do insert it into the survey as well. We'd appreciate if everyone can fill it out just to make sure we're appropriately turning future workshops to make sure it's actually useful and very impactful to everyone attending the workshops. So please do go ahead and fill out the survey and do let us know if you have any questions. Thank you all. Neil, Jessica, any final statements, thoughts?
I would just say thank you to all of you for sharing your time and your willingness to engage with quite difficult breakout exercises. It's really appreciated, and I hope it was useful. So I look forward to speaking with you again in the future. Jessica, shall I pass you the floor to wrap up?
Sure, no, thank you all for joining us. And I know it was very short but interactive as well. And it was our first workshop of a series of workshops that we're planning in the future. So this has really given us some thought to in terms of future workshops and how to conduct them. But we do really appreciate you all coming in and being very participatory, and encourage you to share this workshop with your colleagues, and particularly the new ones that are about to come out. If you're interested in joining those, to please sign up when we announce those. But thank you again for everybody for coming.
Okay.
Thank you.
Have
Bye
a great
now.
day. Take care.